Here to discuss the long-term impact of today's political uncertainty on American healthcare, please welcome Dr. Demetre Daskalakis, former director of the CDC's National Center for Immunization and Respiratory Diseases, with Atlantic contributing writer Evan Smith.
Good morning.
Good morning.
Until a few weeks ago, Dr. Demetre Daskalakis was one of the nation's most faithful and most expert stewards of public health. An infectious disease specialist who, as you heard, was director of the National Center for Immunization and Respiratory Diseases at the Centers for Disease Control and Prevention. But during the last week of August, following the firing of the CDC's director, Dr. Daskalakis resigned alongside two other top officials of the agency. He did so quite publicly, posting a lengthy statement on social media. It read in part, "I am unable to serve in an environment that treats CDC as a tool to generate policies and materials that do not reflect scientific reality and are designed to hurt rather than to improve the public's health." We're lucky to have him at the Atlantic Festival. Dr. Daskalakis, welcome.
Hi, Evan. Nice to see you. Thank you for having me.
So, there is so much news out of your world that we could start almost anywhere, but let's talk about what literally happened while we were backstage. Secretary Kennedy's Amen Chorus Vaccine Advisory Panel has been meeting over the last 2 days to vote on vaccine recommendations. Yesterday for measles, mumps, rubella, chickenpox, today for hepatitis B. Tell us what happened.
Other than just a lot of chaos, which I think is probably what the goal was. Yesterday, the main focus was on the measles, mumps, rubella, chickenpox combination vaccine.
Right.
And they voted with really no new information, nothing new happening, no real reason to revisit. They voted to not allow kids under 4 years old to get that combination vaccine. Now, the kids can still get measles, mumps, rubella vaccine plus a chickenpox vaccine, so 2 shots, but they can't get the combo shot. So it's kind of like low intensity what they did in some ways, because 85% of kids were going for the MMR plus the separate varicella or chickenpox shot, so only 15% of kids took the combo. So it's more the principle that they, with no data, with no reason to do it, have just removed a vaccine from the pediatric schedule.
That's the problem. The problem here, as you've identified as your fired former boss, Dr. Menares, identified in Congress this week, there is no scientific basis for this decision.
Yeah, so usually when questions come to the Advisory Committee for Immunization Practices, there's something new, or someone's identified something that needs to be discussed.
Or there's a precipitating event.
Right, there's a new vaccine, there's new safety data, something happens. So the agenda for this meeting was decided by Robert F. Kennedy Jr. Like, he just said, this is the agenda. The team had 1 month to prepare. Usually questions take about 12 months to go over through a process. And so the CDC scientists, who I'm gonna say out loud, are amazing, hustled. And they put together documents and presentations that at least gave part of the story, but didn't go through the process to look at all of the story. And that's what we saw yesterday fall apart with the chaos at the end with crazy votes that made no sense.
And let's just, for the benefit of people here and people watching, this was a 17-member vaccine advisory panel. Secretary Kennedy dismissed all 17 members summarily earlier this year, replaced them first with 8 and then eventually another 4, most of whom agreed with his vaccine skepticism, right?
So
he basically stocked the cabinet with people who he knew would carry the same message.
And he said that. So
and he said it out loud.
Yeah, all of the people that were let go of, the 17 that were dismissed, they found out in a Wall Street Journal article and on X. So that's how these very well-respected scientists learned that they were terminated.
Right.
And in that Wall Street Journal article, what he said was that the previous administration had put all of these political appointees on this panel, and now I'm getting rid of them so I can, make America healthy again, radical transparency, gold standard science, which is all Orwellian doublespeak. So they were removed, and then in come a group of people who are entirely ideologically aligned to R.F. Kennedy Jr. There's one who wasn't. And so the rest were all aligned, and so that's it.
So today, actually, the news was a little bit better. There was a vote on the hepatitis B vaccine recommendation, which many people assumed, I assumed, maybe even you assumed, that, assumed the worst. But in fact, they tabled it.
Right. So a couple of days ago, I put out on social media that they should table it.
Yeah.
Because that's the right thing that they should have done. And so I'm not saying that they listened, but I feel like the combination of Senator Cassidy, who's a hepatologist, saying, this hepatitis B vaccine prevents liver cancer, death, and transplant, whatever we've been doing in terms of being very vocal, whatever Susan and Deb Oury did in Congress, maybe that dislodged this plan. But so they tabled it. So now what that means is maybe they're going to take it into the likely 12-month-long process of review. And then potentially with the entire story, with all of the parts of the story reviewed, they can make a decision. Now, I don't know if that's what's going to happen.
No guarantee this is going to go well, but at least for the moment, flat is the new up.
Totally.
Right?
Like we'll totally take that kids can still get, that they have not removed access to newborns for hepatitis B vaccine. That is like a small miracle today.
So instead of science, we get what? We get feelings as facts. We get politics. You actually today on social media talking about this said, this is what public health has become, a manifesto.
Yeah. A
manifesto.
I don't even have to sort of say that as a dramatic soundbite. You can go to the CDC website, and now on their landing page about CDC, they put up a several-page manifesto that in effect just goes through the administration's priorities and says that they're going to be fully aligned. And so, they're talking about gender ideology, all of the things, and they're going to say CDC is fully aligned to this agenda. CDC historically has not aligned itself to a political agenda.
Right.
That's not what it does.
The point is for it to be independent and have it be independent based on scientific evidence.
That's correct.
Right. And in fact, now we flipped the table here.
It is an ideologic machine.
Right. Let me ask you about the motivations for this. This may seem obvious, but I do want to ask you about this. Is it ignorance or is it malice? I ask because a word jumped out at me when I first read your resignation letter, designed. What you said was designed to hurt the public's health. That suggests intentionality.
Yeah. I 100% stand by what I said.
You think it's malice?
It's malice. I do think it's malice. I think that there is, these people really don't know how to govern at all, right? Let me just start with that. So I've worked in government for a long time. They don't know how to do anything. And so the initial shock and awe at CDC, where they just randomly fired people, did searches of people's jobs and said, it says equity in their title, so fire them. So that part was sort of shock and awe. The subsequent pieces have been really designed to remove the scientific leadership. Like Dr. Menara said, and I believe her, that when she talked to RFK Jr. on the 25th, he said, keep firing people until you get down to a level where the people are just going to do what I say.
Yeah.
Did you hear the gasps?
Right.
But that's what he said. I 100% believe it because that's what we're seeing happening at CDC, at NIH, and all these other health organizations, where it's remove the people who know, go to the people who are lower in the totem pole until you get to the place where you have compliance.
Yeah. I watched the confirmation hearings when then nominee Kennedy was before the Senate, and I know what he said in his confirmation hearing, and I know what he implied in his confirmation hearing. But obviously, we now see something the opposite of what he said, right? Do you have any doubt that this is his agenda? There's not a Stephen Miller of public health pulling strings in the department. This is his agenda.
Yeah, I wonder if Aaron Siri is involved.
Tell me who that is.
So, I think that there's a lot of folks that could be involved, but I think that there's, the Children's Health Defense Fund, the organization that he set up that is staunchly anti-vax, who came down to Texas and were promoting therapies for measles that weren't real and sort of touting the bravery of doctors that took care of kids with measles while they themselves had measles, which is malpractice. I think that the answer is that, this is all very purposeful.
Yeah.
And,
But of course, I have to point out, this is a little bit of trivia. It's not material necessarily, but it's interesting to me. You know what you know of his motivations secondhand.
Yeah, I read his book.
You don't know it firsthand because you told me this week, and I was like, what? You never met Secretary Kennedy in the 7 months that you were the immunization lead at CDC.
Yeah,
You never even talked to him.
No.
You didn't even get on a Zoom with him. You literally had no FaceTime, real or virtual.
Nope.
And how ordinary is that? How unusual is that for somebody in your job to literally have no contact with the secretary?
I mean, the man seems pretty interested in vaccines. So it seems rather odd that he wouldn't talk to the vaccine chief.
Yeah.
So I'm just realistically speaking, seems like maybe. So last administration, I would routinely meet with Secretary Becerra. I had a lot, I was the head of the national Mpox response at the White House. I was in the COVID vaccine response, all of those things. And those are big ticket items, like really important things. And I would have meetings with Becerra, not by myself, but like in the context of briefs. We offered Secretary Kennedy brief after brief after brief. Let's brief you about measles. Okay, so if you're tracking, he's never been briefed about measles by any subject matter expert at CDC, no matter what he tells you in front of Congress. He said that I was briefed by, he said a name, Bill Thompson, who is someone who has history in vaccine, but he has nothing to do with measles, nothing to do with the responses that he needed to be briefed on. So literally, I've never met the man. The senior leadership at CDC, other than Deb Oury, has never met the man. He has never done a Zoom to CDC, even in a large group. We've seen him address HHS and spout all of the Orwellian doublespeak, gold standard science, radical transparency, but have never interacted with him at all.
Quite extraordinary.
Yeah.
So after you quit, you gave an interview. Well, you gave a couple of interviews, but the one to The Advocate, I read with some interest. And you said, the CDC you knew is over. Unless someone takes radical action, there's nothing that can be salvaged. I mean, that's, tell us what you think. I mean, like that's bad. I mean, you're saying.
Not good.
Yeah. And look, we've spent a lot of time talking about vaccines, but as we were talking about backstage, there are a whole bunch of other things we could be talking about that 100%. Fall into the same category. We're no longer going to do mental health screenings for children in schools when we have said repeatedly that gun violence in schools is not about guns, but it's about mental health. Or fluoride, bye-bye to fluoride, right, in water. Like there are a whole bunch of things that have happened. You believe that now so much damage has been done that effectively it's over. Yeah,
I mean, I think that it's probably really hard to salvage for lots of reasons. So one, like they've radically cut the place. There's no staff there. There's no more legacy of expertise. Like hundreds and hundreds of thousands of years of expertise have been cut out of that place. Yeah. The ongoing denigration of public health officials and staff means that who in the hell wants to be a public health person anymore, right? Like, are you going to go to get your master's of public health? As a quote, my friend Robert Malone from the ACIP says, a master's of public health is a socialist degree because it's worried about the community and not the person. That's what we're up against.
So the first level consequence of this is we all suffer for not having a CDC, but the second level consequence may be that we dissuade anybody from becoming the next generation of public health experts. The next Demetre Daskalakis are not going to go into this field.
Yeah. I mean,
as a consequence of this.
I think that's right. And I mean, I think the rhetoric around attacking public health, vaccines, that's why 500 shots were fired at CDC. Like we
haven't talked about that, but of course that was an extraordinary thing.
When I quit, I had to go to my office and, because I'm such a terrible public health official, I had to dust off lots of my trophies from like literally glass dust, because I had surgery the day of the attack. Had I not had surgery that day, I would have been sitting in my office when the bullet went through the window. And so, that's real. And so the verbal attacks, and this is an example, when Secretary Kennedy, he came to see the gunshots. We were all not there because we were working from home because, you can't work in glass. And thoughts and prayers is what he gave. And then he immediately went and did an interview where he said, don't trust public health experts. So he's as responsible for those gunshots as the gunman, in my opinion.
You surely know that yesterday, and in fact, the last 2 days, what we've seen in response to the CDC effectively going offline has been coalitions of states saying, in place of the federal government making vaccine recommendations, we're going to do it together ourselves. So 2 days ago on the West Coast, you had California, Oregon, Washington, Hawaii. Yesterday, you had a coalition of states on the East Coast say, we're going to step in and we're going to make vaccine recommendations. I mean, look, I understand the world today. We're living in the United States of you do you, right? Like, this is an every man for himself, every woman for himself world. But is this really the best way for us to manage the infrastructure of public health by saying it's going to be reduced to coalitions of states stepping in?
No, it's not good. I mean, they have to do this because they're not given a choice. They have to step up, or otherwise the health of the people that they serve will be damaged.
What are the complications of that? I mean, is there a problem with, unequal recommendations in this coalition of states and that coalition of states, an inconsistency?
100%. It's going to be, I mean, what happens is you create a have and have not sort of situation in the U.S., which we already have, but now it's going to get worse. Like, I'm not hearing about Mississippi, Alabama, Louisiana, and Georgia coalescing into an organization because it's not really in their sort of political will, and it's also, they're not resourced to do it.
But also, Dr. Daskalakis, if those states, I'm going to make an educated assumption here, that if those states put together a coalition, their recommendations would be wildly different.
Probably.
Than the recommendations in the Northwest or in the East.
Maybe. I mean, I think that it could be because of the sort of environments, but I do think that the patchwork that it creates is going to cause confusion to providers and to patients. And whenever a patient and a provider are confused and they don't know what to do, they tend to move to an action.
Right. A reality that we talked about this week is that what we're seeing right now did not happen overnight. I mean, as much as you might want to say, others might want to say, this is about Robert F. Kennedy Jr., this is about this administration's HHS. The reality is that we have been debating and arguing over many of the things we've been talking about for several years now, predates Trump 2.0. It was really the pandemic
I agree.
that was the catalyst for this. That's what started us down this path. At that time, you were working right here in the city of New York on pandemic response. You were here back then. So how did we get from there to here?
I was on this really interesting podcast right after I resigned, and it was with folks that were from the MAHA perspective. And this one person said this fascinating thing, which is, I didn't think about public health at all, and then the pandemic came, and it seems like they were in my business for the first time. And so I feel like, public health dutifully lives below the radar to make sure that things are going well so you don't know that we exist. And so all of a sudden, we're front and center, very politicized, right up there. And people didn't necessarily do a great job, frankly, during the pandemic.
Who are, when you say people, who?
I think everybody.
Specifically.
I think me included in New York City. I think all of us, in the middle of the catastrophe, I think that there were sort of political pressures to say that you had more sort of, confidence in some of the things that you were saying to build confidence in the community more than you necessarily had scientifically. One of the things that keeps getting brought up is, we are 100% confident that the COVID vaccine is going to prevent infection. Remember that? We lived that together. And that's not what really played out. And so I think that that's just, something that is a lesson to learn, that the absolutes of science, nothing is actually absolute. And, one of the things that I think about is, very often, scientific truths change over time as new data emerge. And in the sort of era before, fast social media, that would just sort of happen gradually. But you can now take snapshots and say, on Tuesday you said this, on Wednesday you said that. And so the science changing is then sort of billed as being something that is disingenuous or false claims. So it's just the speed at which we are getting the information means that, as science moves, it looks like someone is either lying or doesn't know what they're talking about when the data change.
But of course, exactly what you just described is the basis out of the mouths of people who are themselves vaccine hesitant for vaccine hesitancy. Well, you told us that the COVID vaccine was going to be all that, and it wasn't. So why should we believe you now, is what they're saying.
And that's going to be a decades-long sort of discussion, because I think it's going to be hard to get there again.
So let's talk, I was asking you about how we got from there to here. Let's talk about where here is specifically. We had some really interesting data points published this week. Washington Post, Kaiser Family Foundation Results of a poll were published. At least 1 in 6 parents have skipped or delayed a vaccine for their child other than COVID or flu. 1 in 6. So we're talking about measles, mumps, rubella, tetanus, whooping cough, Hep B, chickenpox, polio. 52% of parents did not vaccinate their children for flu in the last year, and the CDC's own estimates show that a majority of children had received flu shots every year since 2010. It's been declining since 2019. How many flu deaths among kids you cited today or yesterday?
271.
271 flu deaths in children.
90% unvaccinated.
Right, 90% unvaccinated. And to the point about unvaccinated, this is from an NBC News report this week. Among states collecting data for the measles, mumps, rubella vaccine, now 68% of counties in the country have immunization rates below 95%, which is the threshold for herd immunity to protect against an outbreak. So literally 1/3 of the country is no longer at the herd immunity threshold. Crazy.
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 I mean, when the call is coming from inside the house, from trying to sort of destabilize sort of the vaccine effort, it becomes really hard for public health to try to improve confidence in vaccines, understanding that it's an uphill battle, right? So now not only is it an uphill battle, but we also have like this entire burden on our backs trying to pull us back even further by creating chaos. Mis and disinformation, confusion, and chaos.
Right. I want to spend, we have a couple minutes left. I want to spend a little bit of time talking about the measles outbreak of the last year, because I live in Texas. You actually worked on the measles outbreak in Texas at the CDC. This was a legitimate outbreak, the largest measles outbreak in 30 years. 762 cases of measles detected, more than 2/3 involving children, 96 people hospitalized, 2 children dead. Almost all of those infected were unvaccinated. The epicenter of the outbreak, where it originated and where more than half the cases were diagnosed, was Gaines County, Texas, in West Texas. The vaccination rate there is only 77%.
That's right.
Right. So this is exactly the simulation being run of what you're talking about.
That's right. And, you know, I got to go to Seminole, actually Lubbock, Seminole, and Austin, and sort of got to sort of see the story. And you know, I'll say that one of the challenging parts, I mean, I led the measles response in New York City that happened in Brooklyn in the Haredi community in 2018, 2019. And so I have a lot of measles experience, especially with close-knit communities that may be really hard to communicate sort of vaccine information to. And this was an example. It was mainly among Mennonites in that area. And, you know, it was a hard thing to do at baseline, but I'll tell you the hardest part was having to deal with the mis and disinformation on the ground, as well as the mis and disinformation that Secretary Kennedy was touting throughout the country. So he, you know, went weeks and weeks not saying the word vaccine once while we were trying to increase measles. I'm never forgetting, like, we were in the midst of this measles outbreak, and he had the first cabinet meeting with the president, and he says, yeah, it's no big deal, and then he got the number of deaths wrong, which maybe he should have been briefed. Maybe he would have gotten the number of deaths right. But literally, like, minimizing the importance of an outbreak that had already outpaced last year's measles cases by the time he said that, and then saying, you know, measles vaccine prevents this, and then 3 seconds later saying vitamin A, inhaled steroids, and antibiotics that, like, do nothing for this are the way that you should go, and then saying that the doctors that supported those strategies were actually heroic. That's not helping anyone. And so, you know, those deaths, the fact that we couldn't control that outbreak in the time that we did, that's why.
And this is, I think, the takeaway. This is why the conversation around vaccines is so complicated. People say, well, you know, you're impacting my liberty. If I choose not to offer a vaccine to my kid, that's my choice. And they liken it sometimes to the seatbelt requirement. You know, well, when the government mandated the use of seatbelts, well, the only person who is hurt if I don't wear a seatbelt is me. That's not the case with these vaccines. No. At some point, your liberty is my problem, right? At some point, your liberty is my problem, because if these are infectious diseases and you choose not to get vaccinated, you're impacting all the rest of us.
That's right. I mean, it's like, if I crash and have my seatbelt, your airbag goes off and hopefully you don't get killed, right? So you know, this, especially Measles, mumps, rubella is a great example. Many people just can't get the vaccine. So if you have friends who are immunocompromised, bone marrow transplant, whatever it is, they can't get it. So the protection of the population means that you're protecting the people in the population that can't get it. So it's not at all a seatbelt. It is a social contract, which may be a different conversation for another day, because that seems to be not prioritized.
So in the last 20 seconds that we have, can we undismantle this? I mean, I keep looking at the dismantling of everything in government over the last 7 months, and I keep asking myself, what's it going to take to undismantle this? Assuming people were put into position of responsibility who wanted to undismantle it, how long would it take? What would it take? Is it even possible?
Yeah, I mean, and in public health, there's three things that you need. You need community engagement, so understanding what the people need. You need good science, and what really lifts the whole thing up is political will. So where there's no political will, who cares about the science and who cares about the engagement with the community? It's not going to matter. So I think that the first step in this is dislodging leadership that's not actually responsive to the needs of people's health. And so you can interpret that as you wish. Right. And then the other part is, this is going to take decades to fix. What was destroyed in 8 months will take decades to fix. And so that means that we are at risk not only for like my health and your health, like we have zero global visibility in what's happening with infectious disease right now. We have like a 60% reduction in the number of samples that we're getting at CDC to look at what flu is circulating and what the next pandemic strain is going to be. We've gotten exactly zero polio specimens since February, and usually it's in the hundreds globally. We've not done one measles lab training to make sure labs are doing the right thing globally to sort of provide us information, and an over 70% reduction in understanding of what's circulating in COVID. So red flag is up, and I can't put it up any higher. If there's not a change, we are at risk for our personal health and the security of our country.
All right, we have to stop there. Thank you so much for being here, and thank you for your service. All right, good. Thanks. Great work. Thank you.